Also, each department will have staff members hold a collateral duty to ensure the staff are attending training when needed. Goal 3, to identify all locations performing moderate/deep sedation by providers other than anesthesiologists or CRNAs. We discussed this a couple of slides early. Goal number 4, to identify all equipment utilized for the performance of sedation within the identified locations. To be in compliance with BUMED instruction 6710.67C and to develop a plan or recommendation for standardization of the equipment utilized for this function. Philips monitors are mostly supplied throughout NMCP, but not all of them have capnography abilities. Only monitors with capnography are located in the ICU, the PICU, and the ER. Piped O2 or transferable O2, crash carts, wall or portable O2, is available as well on the units and in the clinics. Goal 5, ensure that steps are in place to sustain an ongoing oversight of equipment, personnel, and processes. The quality improvement plan will include having all staff that perform moderate sedation at NMCP attend the training based off of the new policy and annual training thereafter with the acquired amount of cases. Also, appropriate record review, peer review as needed to track and trend reportable incidences and adverse outcomes. Controlled substance utilization review and equipment maintenance review will be done as well. Evaluations. So due to some barriers, we've had some delays, equipment problems, and issues with training. So because of these, the policy standardization was not put into effect in a timely manner. Awaiting approval from BUMED and the DHA, equipment is being ordered for the departments that do not have continuous monitoring or capnography capabilities. The plan, when the policy is finally put out, to audit the nurses that perform moderate sedation, and surveys will also be given out to the nurses that act as the monitors or recover the patient after sedation to see if they are knowledgeable about the policy. Also, the surveys will be given to the corpsmen if they are recovering the patient. Forecasted. So we forecasted the cost of the equipment, outcomes, and training. The cost of sedation includes the time of the personnel required for monitoring and recovering the patient and is based on the length of stay and medications used. Because the risk of deep sedation, it is required to have monitoring for heart rhythm, pulse oximetry, and capnography. Therefore, the cost for standard sedation can be as much as $4,000, approximated. And in case of an sentinel event, the cost of treatment for intubation and ventilator use is approximately $2,000 a day. Forecasted cost for equipment purchases of the monitors with capnography is approximately $5,000 a monitor. Forecasted outcomes will be a decrease in adverse reactions and sentinel events to be below the national benchmark of 2%, and an increase in nurses' knowledge about the moderate sedation policy. Training for the staff on the new policy is approximately $180 per nurse. This is based on an hourly rate of $45 for a 4-hour class. Will this project be a success? The moderate sedation policy at NMCP will be in accordance with the BUMED policy and national standards by addressing the training of the staff, monitoring requirements, medication guidelines, recovery procedures, and quality assurance. Making sure everyone is following the same policy leaves no room for errors and improves the patient outcomes. Our goals are being met even with a delay in the process. We have identified all locations performing moderate sedation and ensured the departments have the proper equipment. Each department will be responsible for tracking and maintaining staff moderate sedation training until the SWANK program is up and running. The good and the bad. What I feel went well was the communication between the staff, the effectiveness of the teamwork, and overall the policy meets national standards. Nobody really wants to volunteer for projects because they are too busy with patient care or running a unit to find the time to participate. This group worked very well to standardize this policy, even though everybody is busy. Unfortunately, all their hard work was not enough. Barriers were put in place that the group had no control over. For example, the validation process with BUMED. We are currently still waiting on the results of this. The budget. Nobody really knew how much money we could spend and how much money was needed for budget approval. And because of the lacking of these two areas, the time management was bad because we were unable to put out the policy in a timely manner. The project and program outcomes. The standardization policy on conscious sedation project supported 3 of the learning outcomes from the ECPI student learning outcomes. Outcome number 4. Act as a change agent by subsistaining and applying research outcomes in practice and education settings to resolve nursing practice problems and translate and disseminate resulting nursing knowledge. This goal was met by ensuring the policies to meet current standards of care from the Joint Commission, the American Society of Anesthesiologists, and guidelines from the Center of Medicare and Medicaid Services, and changing the policy when needed. For an example, adding the capnography. Outcome number 5. Ethically utilize current technologies to communicate the interdisciplinary team, improve and coordinate care across the continuum, strengthen the delivery and outcomes of nursing education, and analyze healthcare data. This goal was met by developing spreadsheets for the departments to track staff training, their equipment needs, and issues the department had with the new policy. The use of email was used to communicate updates and meeting times. Outcome number 7. implement current standards of practice and healthcare policies to design, deliver, and manage and evaluate culturally appropriate evidence-based education and nursing care for selected populations. This goal is met by ensuring patient safety is the #1 priority by all the departments, by having all of the departments follow the same policy and ensuring good care and outcomes. Okay. These were the references that were used. Thank you for watching my slideshow, and have a good day.